My name is Megan Clanahan. I am the co-owner of Houston Moms, and it is my pleasure again to bring to you health experts every month from UTMB Health. We want to highlight and give you education over various topics this year. And so it seems strange, but top of mind right now, even though it's July, is we're going to be back in school in about a month. And so we thought no better time than to bring in a wonderful pediatrician from UTMB Health. We have Dr. Manuela Murray, who is with us today. Dr. Murray, thank you so much for joining us.
Thank you so much for having me. It's a pleasure to be here and talk to you guys.
Yeah, we always enjoy it. You guys bring so much valuable knowledge to our Houston moms, families, and parents. So can you just tell us a little bit about yourself, your background, and where you practice?
Absolutely. I actually went to medical school in South America, in Colombia, and I moved to the States and did my residency training here in pediatrics. And since I finished, I have been with the University of Texas Medical Branch, UTMB, in Galveston. My clinic is actually up here in League City. And I do various jobs. We teach, we do research, we do some administration. I am the director for the pediatric clinics for the Department of Pediatrics.
Love it. Well, thank you. I know you bring a wealth of knowledge. And so we're just going to dive right in. So as we are thinking, we're in July, getting ready for school and sports and all of the things. What is UTMB's recommendation as it relates to physicals and sports physicals and kind of, getting back into that regular routine of regular checkups? What does that look like for y'all?
Yeah, so we absolutely like to see the kiddos that are school age about once a year, or of course more often if needed. But for regular checkups, at least once a year, those checkups are extremely important. We're going to be doing their blood pressure. We're going to check their vision, their hearing. We're going to assess their growth, their development. We start at 12 years of life, also assessing their mental health, making sure that everything is good in that regard. And we do, of course, a full physical exam for kids that are participating in athletics. It's extremely important to also get a sports physical, which is kind of the same as a well-child check, except it has, in addition to it, a more complete musculoskeletal exam. And it also includes a questionnaire that has a series of questions that are going to lead us to think that maybe that kid may need an extra evaluation by either cardiology or another specialist before they can safely play sports.
And I think that's so important. And I've said a handful of times, my daughter was born with a congenital heart defect. And I think, screening and making sure that our kids are going to be healthy out on that field, and especially running around in these crazy Houston temperatures and humidity, and hard on any child. But you especially want to make sure that there's not any sort of underlying, condition there that, would hamper them from being able to participate in sports. So I think that's super important. And kind of going into that, obviously, I think during COVID, a lot of us put these regular well checkups on the back burner. And just because we didn't want to have extra exposure or, all of the things, what would you tell those parents who may have just, kept delaying?
I think what I will say is, in fact, we never stopped doing well-child checks during COVID, at least in my institution. And I know that everybody in the country tried really hard to continue to get the kids in, because we know how important vaccinations are and how important these checkups are. And so what I will tell those parents is, it is so important. A lot of the complications that we have seen from the pandemic have been from people not seeking medical care in a regular basis and in a in a appropriate fashion for what they are having. And so we have worked really hard to make our clinics safe. We have all of the protective equipment to protect ourselves, our staff, and our patients. We have made modifications in the waiting room, in the process of how we bring the patients in, the cleaning procedures. We work very closely with the infectious diseases specialist and the epidemiology at UTMB to really try to put in place processes that make sense and that provide that safety so that our patients can continue to access the care that they need.
And I think that's so important. You know, what you said, that some of the things that you are seeing could have been prevented by having those well checkups. So mamas, go ahead, get your babies, get everyone in, just have that one. So for we've done it. I mean, it's super painless, and I know y'all do a great job of keeping everything clean. I almost like post-COVID procedures for pediatric offices because it's like there's very little wait now, and it's just go in, get it done, and check the box, hopefully for the next year, right? So you mentioned vaccines because I know you were referring to regular vaccines and those regular vaccine schedules. But let's talk a little bit about the COVID-19 vaccine. So who's eligible for that? What is UTMB's recommendation, especially for our 12 and up crew heading back to school?
Yes, so the Pfizer vaccine is the only one that is available for children. It is approved for children 12 years and up. It's actually been approved for children, teenagers 16, 17 and above from even earlier in the year. So we have already vaccinated a lot of children. The recommendation really doesn't come from UTMB. The recommendation comes from the American Academy of Pediatrics and a bunch of other nationally recognized organizations that we practice by and we follow. And the recommendation is get your kids vaccinated. The vaccine is safe. The vaccine is extremely effective at preventing COVID. And now that we are starting to see that this virus is able to mutate and become more infectious and more aggressive and is looking for ways to kind of get away from everything that we have put in place to stop it, it is going to be extremely important that we get as many people in the community vaccinated. And of course, our kids are going to be a crucial part of that. I also wanted to touch base on, because I get this question asked a lot by parents of younger children, since they are going to be going back to school too. So there are studies that are being done right now in children that are 5 through 11 years. And we should hopefully, fingers crossed, have those results and that approval by the end of the year, the calendar year.
I personally, I think that's so exciting. You know, as we've seen these studies kind of play out and play out so positively that we know it's effective, that it's safe, that it's working. I have friends who are doing the studies right now with their littles, and I'll be interested when all of that comes out. So since we have the 12 and up group, so thinking of going back to school time, when should they start so that they will be fully vaccinated by the time school starts? Mm-hmm. Where do we go?
So the Pfizer vaccine is a 2-dose vaccine, and you have to have at least 3 weeks in between the 2 doses. You don't gain your full immunity until about 7 to 14 days after the second dose. So we're looking at about a process that takes 4 to 5 weeks for your body to be able to mount that immune response and to be able to fight the virus the best. So I will say some schools start mid-August, some start the last week. I think we're right on that timeline. We need to get the kids in as soon as we can right now for their first dose. So by the time school starts, we have them protected.
Thank you for that. Yes. So moms, dads, if you're watching this, let's start now. Let's get them in, and especially while they're laying low, and if they're like mine on screen time anyway, they have some time to maybe feel a little bit of a headache, or some side symptoms. And so let's go ahead and get that done, because I think, and I'm sure you're probably seeing this too, I'm fully vaccinated, but there is sort of this, like, we're going back to normal sort of feel. What else do we need to do, kind of thing? Well, this would be the next thing that we need to do. We need to protect our kids, because I think most, if not all, districts, mostly in our area, are going back face to face. So this is happening. So let's protect as much as we can. So such great information there. Next time we chat, if I chat with you or someone else, I'll be so interested to find out about it was at 5 and up or 6 and up?
5 through 11.
5 through 11. I'll be so interested to find out the results of that. So I'm sure we will have that in an upcoming video as well. So we talk a lot about physical health and keeping our kids, healthy from COVID, or just, different day-to-day things. Things have happened over the past, 16 months that have affected our children's mental health. So how does UTMB Health, as a pediatric practice, look for mental health issues maybe in children, identify those who might be struggling, and then what would be the recommendations from there?
So mental health is something that we always assess for when we're doing well child check in children. And at the younger ages, it's more just talking to the parents, making sure they don't have any concerns. If they bring something up, making sure that we explore those symptoms to see if they are still within the normal range, or if they're kind of getting to the point where they're getting out of control. Actually, starting at age 12, we do a formal depression screening for children. And some of the symptoms that come out during those screenings also lead towards other mental health conditions like anxiety. And yes, you're right. Definitely during COVID, during the pandemic, we have seen an increase in anxiety symptoms, depression, kids not being able to socialize, to see their peers, to get outside, to go to the places where they like to go. And so it's very important that we help the parents recognize them, but also that the parents have their eyes open for them. And they realize that maybe sometimes if your child is just having changes in behavior, not sleeping as well, not eating as well, not wanting to do the things that they used to want to do, that they used to like be ready to get up and go for, those are all red flags. And it is a good idea to bring it to your pediatrician's attention. There is a lot of resources in the community that you can reach out for. Harris County, I know Galveston County and Harris County both have a family service center. So if you just Google Galveston County or Harris County, Galveston Family Service Center, they have counseling for families and patients, and is very relatively easy access. Some of the psychologists and counselors out there with the medical centers have a really long waiting list. So those are resources that people can keep in mind. And also through the counselors at school, those are a great resource, because the kid doesn't have to miss school to talk to them. And so if we bring to their attention, hey, they're struggling, please keep an eye on them. They're very helpful and always willing to maybe pull them for a few minutes a day or every week and check on them and make sure that everything is okay, and maybe give them some tools to deal with those emotions and those feelings that they're having. But definitely, if it's getting to the point where things are getting out of hand, bring it to the attention of your pediatrician so it can be addressed in a more professional way.
I think it's so important, so that it turns out to be this trifecta of parents, your pediatrician, and your school, because those are the three main influences, if you will, in our children's lives. Just on a personal question, sorry, there's an Amber Alert, apparently. Sorry.
Mine is probably gonna go off next.
So on a personal level, How do you recommend parents approach a pediatrician if you have concerns about mental health for your child? And like, let's say it's an anxiety issue, because I feel like we're always like, we're in the same room and like, you don't necessarily want to talk about your kid in front of your pediatrician. Like, what have you found is the best method to be able to chat about what your concerns are without like, not hiding it from your kid, but do you know what I'm trying to say?
Definitely. Well, to tell you the truth, both for physical health and mental health, we have learned through the years that when the child is involved in the discussion, both about what's going on and what the treatment is going to be, the outcomes are better. And so we definitely recommend the child to be in the room. If it gets to the point where we really think that we need to have a private chat with you, we will at that point kind of put a twist to things and either tell you I'll call you back later to talk a little bit more about that or something like that. But we definitely do encourage the parents to have the discussion with the child there, because it's their health, it's their little body. And even though we're still making the decisions for them because they can't do it themselves just yet, it is their health, and we want them to be involved in taking care of themselves.
That is seriously profound advice. Because we want them to also feel, when you said emboldened, like we also want them to be advocates for themselves and say
Absolutely.
that something doesn't feel right here. And so, yeah, we don't want to talk above them. I think that, and they have to be part of the solution too, if they're not feeling quite well. So I don't think they want to feel like a sheet's been put in front of their face. So, great advice there. Is there any other, as it relates to pediatrics and back to school time, any other nuggets that you have that you'd like to share?
Yeah, absolutely. There's actually two things I would like to talk to you guys about. The first one is a lot of parents have been asking about, it's been on the news, about the cases of myocarditis that have happened with the COVID-19 vaccine. And so I wanted to let everybody know that, and they have happened mostly after the second dose in teenagers, but I want everybody to know that the American Academy of Pediatrics and other 13 national recognized organizations that deal with children's health have gotten together. They have looked at all the data that is available, and they have come to the conclusion that definitely the benefits of the vaccine outweigh the risk. Yes, there have been a few cases, about 300 out of the thousands or even millions of people that have been vaccinated. They have been mild, they have been, they resolve on their own, they need very minimal treatment, and they don't leave any sequela. And in fact, COVID-19, the illness itself, can give you myocarditis that might be more severe, not resolve on its own, and leave some sequelas. So we have come to the conclusion, it's something that we watch very careful. Anytime that we're administering vaccine to children or that we're doing vaccine research, we want to know everything, and we want to look at every little thing that could potentially happen. And so rest assured that so far that is not a reason to not give your child a vaccine. It's definitely indicated and beneficial.
Wonderful. And now, from a UTMB standpoint, where would you go to register your child to get a shot? Do you just go to the website?
Yeah, the website is the best way to do it. So when we started vaccinating at UTMB, we had like these vaccine hubs where we were doing the majority of the vaccine, but now we're in a transitioning stage where we are actually bringing the vaccines to the clinics. So your pediatrician could very well have the vaccine at their clinic. And so definitely if you go to UTMB and in the little search box, you type COVID vaccine, it's gonna pop up. There is self-scheduling. So you can potentially just make the appointment, choose the slot that you want and make the appointment yourself. I know that a lot of the pharmacies out there also have the vaccine available. So there is plenty of ways to reach the vaccine. And we're at the point in the pandemic where if you want the vaccine, you can get it. I mean, it's readily available. We have plenty of it. So go ahead and get those kids vaccinated.
Yeah.
there was one other little thing I wanted to
Sure.
raise awareness about, and it is overweight and obesity in children, because that is the other thing that the pandemic has brought to us. Almost every child that I have seen for a checkup has gone up. Even kids that had always had a healthy weight, all of a sudden, boop, they jumped up on the curve. So being at home, not being as active as we used to be, maybe snacking more because the pantry is right there, the refrigerator is right there, and we're bored. Yep. So I want to raise awareness, and I want to make sure that all the parents are kind of like stopping and thinking, okay, this virus is not going anyway. This is going to be around, and this is just our new normal. And we have to do what is best for us. We have to go back to that healthy lifestyle that we used to have, and try to really look at portions to make sure they're eating plenty of fruits and vegetables, drinking lots of water, limit their screen time. That one is tricky. And also getting outside and playing as much as possible.
Great advice. And I think it is we kind of lived for a year like, well, it's just an extra treat because we're all going through so much. And, but now it's time to buckle down. Gyms are opening. I know that I've enjoyed being active again. And it's important for our kids too. Get out there and ride some bikes, even if it's just for 10 minutes in the heat. To do something. And so I think it will be interesting if I were to interview you a year from now, kind of the fallout of, now what we've seen, the rise in obesity or BMIs in kids, or the mental health repercussions. This is going to play out for a while in some social studies. And so, yes. But now's the time to go grab some great fruit, though, from the store. It's like I got some peaches the other day, and they were delicious. So now is the time to kind of have the healthy fruit choices as well, for sure. So great advice there, Dr. Murray. I am so thankful you joined us here today. It was great having you.
Thank you so much for having me. I hope that this is helpful to people, and yeah, go get your kids vaccinated. We definitely need to do that.
That's it. That's perfect. And as always, I will pop in the comments below and helpful links for y'all from UTMB Health as part of our health series with them. So I will pop in that link that you can go find out more how you can get your vaccine through UTMB Health, as well as the pediatric link. And so you can see more wonderful providers like Dr. Murray and all of her associates that she has. And as always, we will be back here next month with another hot topic for you, keeping you in Houston healthy and informed. So thank you, Dr. Murray. And until next time, we'll see you later.
Bye. Thank you.